in the future, and hopefully in the next couple of years, we'll see an onslaught of other Huntington lowering technologies coming into the clinic. So Voyager and Genzyme Sanofi, Unicure, Spark Therapeutics here in Philadelphia, all of them are going after a viral-mediated approach using RNAi. So this would involve a direct injection of an adeno-associated virus into the brain of HD patients to deliver a RNA interfering compound or drug, which would then hopefully have the same result as the antisense oligonucleotides. They're a few years away from the clinic. There are other therapies currently in the clinic, but they are primarily looking to affect some of the symptoms associated with HD. It used to be called Huntington's chorea. It's not called that anymore. It's Huntington's disease, because we know that HD is far more than just a movement disorder. It's a triad of symptoms. It's motor, it's cognitive, and it's psychiatric. And families and caregivers know that it's really not the motor that's the most debilitating. It's that cognitive, it's the psychiatric. Those are the symptoms that are most debilitating. Those are the ones that keep families or patients from working, maintaining a job. Those are the ones that get them out of the house and in a facility. And so we want to develop drugs that could hopefully impact those symptoms. And there's a company called Azavan Pharmaceuticals that's testing a compound that's a vasopressin 1A antagonist. And this is a study that's called the STARE study, and that's currently recruiting here in the United States. And this is to test their compound to see if it can impact the irritability and aggression commonly seen in HD patients. There's a genuine sense of optimism that I haven't seen before. I truly believe we're at the cusp of something fantastic for HD patients. With the initiation of these potentially disease-modifying trials for HD and more to come, it's genuinely, I hope that I'm not here 5 years from now, talking to you. I hope that we can be at a point where we're at a point where the disease is maintained, or we can prevent this from symptoms from even occurring. So it's a really exciting time for the HD research community.